Issues around weight gain have been a real concern for people living with HIV for many years, and recently it's been a topic of considerable debate. Weight gain from HIV medication has often been regarded as a return to health, and for many people who start treatment, particularly if they have advanced disease and therefore lose weight, this is often the case. Weight loss was sometimes regarded as a sign of HIV and could lead to someone being stigmatized for it. HIV has been called slim disease in some parts of Africa and was associated with wasting, so putting on weight through starting HIV medication was a real positive and continues to be today for people with advanced HIV who lost weight before starting treatment. When I started HIV medication in the early 2000s, my concerns were about some of the older medications used then that cause lipodystrophy. At the time, I was working at the UK Coalition of People Living with HIV, and a number of my colleagues and people we worked with were affected by this. In fact, my first combination included AZT, and I lost quite a bit of weight in my legs. However, as time went on and HIV treatment combinations seemed to have fewer side effects, I believe that issues around weight gain caused by HIV medication was a thing of the past. I was wrong. I personally started to hear people raise more concerns about unwelcome weight gain as a possible side effect of treatment about 3 years ago when I started running community engagement discussion workshops for NAM-AIDS-MAP. During these interactive peer-led sessions, people have the opportunity to share their concerns about their health and care in a safe environment. It was primarily women of colour who spoke about putting on weight and believing it was because of their HIV treatment. However, the majority said that their doctor had told them that their weight gain must be because of something else, such as their diet or lack of exercise, or because they were going through the menopause. Of course, all of these factors can play a role in putting on weight, and on average we all put on weight over time. But it didn't seem to be to these women that healthcare professionals were truly acknowledging that their HIV treatment was a contributing factor, or that it was something they should be concerned about. I remember hearing discussions by some healthcare professionals claiming that weight gain wasn't a problem for Black women because we just like to be big. One of the women in my group shared with me that a doctor had actually said this to her when she raised the concern about weight gain from her medication. She was naturally upset by this. She told me that yes, some Black women may want to have bigger boobs or bums, but very few actually want it around their middle, where she was putting on a lot of weight. So please, don't lump us all in together by what you perceive to be our preference about weight. Over the last 2 years, there has been an increased focus on how HIV drugs may accelerate weight gain, particularly in relation to integrase inhibitors and TAF. Trials were showing that people were putting on more weight over 2 years. However, the majority of participants, which is frequently the case, were white men. A particularly important study broke this mould. For the advanced study in South Africa, 60% of participants were women and all but 2 were Black. The results vindicated what women were saying to me. For people in the arm of the study that were both on TAF and dolutegravir, women were gaining significantly more weight than men, 8 kilograms after 2 years on treatment and another 4 kilograms between year 2 and 3. The weight gain for women was progressive and did not appear to plateau. 27% of women on this combination became obese compared to 7% of men. So how do women feel about weight gain from medication? I consulted members of the 4M network of mental mothers, whose members are all women living with HIV, as well as speaking to participants in my community engagement workshops. I was surprised how widespread the problem was and the distress it was causing. Despite the data showing that integrase inhibitors and TAF could cause significant weight gain, particularly for Black women. Many of the women I spoke with still felt that when they raised the problem of weight gain with their doctor, believing it was because of their medication, their concerns weren't taken seriously or any action taken. One woman said, "Since being on medication, I have gained so much weight and always told it's my lifestyle. It's true, a part of it is my lifestyle, but I know it's also my medication and I get no support whatsoever with weight loss." Some said they were offered advice about weight loss and had ramped up their exercise and changed their diet, but still weren't losing weight, with one person going from a size 10 to a size 18 in a few months. Some actually said that since they went on their combination, it felt like the weight gain was dramatic and sudden. For one, virtually overnight. She sent me a message saying, "I developed diabetes after starting medication. Before then, I never had a problem with weight. I actually gradually gained weight. However, after starting my current combination, I suddenly gained more weight. In fact, it was scary as mine happened overnight. I noticed when trying on a pair of jeans I was wearing the previous day and they couldn't fit the next day. I thought I was swollen because of the heat wave we were having, but I never got back to normal after that. I have been put on an injection to help, but it didn't work for me. Instead, it made me eat more." She wasn't the only person who spoke to me about developing diabetes since having their medication changed and putting on weight. Other women shared that they now had diabetes or had been told they had pre-diabetes. The group shared their concerns about other health problems they now had. They felt was a result of the unwanted weight gain, such as high cholesterol, high blood pressure, and problems with their joints. Even those who had yet developed health problems but had put on weight were very worried that they would, sharing concerns of being at increased risk of developing cancer, heart problems, and later in life dementia. Weight gain was also having a negative impact on emotional well-being of some of the women I spoke with. They shared feeling like their self-confidence was plummeting, that they didn't feel attractive anymore. One discussed how her sex life had been dramatically affected and she was becoming depressed. Internationally, women living with HIV have been highlighting the issue of weight gain from medication and raising concerns that their ability to choose what medication was right for them was being significantly hampered. A young woman living with HIV who advocates for others in many African countries wrote anonymously for the Making Waves network about her experience. She said she wasn't given the choice to switch to DTG when she protested this decision, as she believed she had the right to make an informed decision about her health, or at least be given more information. She was told, "You advocates demanded it, so there you go." She wrote, "Since my initiation into DTG, I have added weight dramatically. I am worried about my weight. It is the first thing that people comment on when they meet me. Their opinions have fueled my self-consciousness and continue to lower my self-esteem." She felt that her healthcare providers were dismissing her concerns and blamed them on her insecurities. She highlighted that weight gain wasn't an insignificant side effect, and she was worried it was affecting treatment outcomes. She knew of women who were taking their DTG-based treatment intermittently as an attempt to control their weight gain. It isn't just that healthcare professionals aren't listening to women's concerns about weight gain. I'm conscious that there are many fantastic doctors who are taking these concerns seriously and taking action. However, for some women, it can be difficult to speak up to their doctor about this problem or indeed other side effects they may be experiencing from medication. This is an issue that has been coming up particularly for women of colour living with HIV who've been coming to my community engagement workshops and saying that they are telling me about these problems as another woman with HIV, but they didn't want to talk to their doctor about it. When I've asked why, Reasons have included things like they were lucky to have medication, so they didn't want to question their doctor, that they felt there wouldn't be other options available, or for many, because of previous bad experiences in the healthcare system, they felt that they wouldn't be believed, so why bother? For me, I was given the option to switch to a 1 pill a day combination a couple of years ago that contained TAF rather than TDF. For the first week or so, I was very happy, particularly as I had concerns about my bone and kidney health. However, I very quickly put on a lot of weight, and when my hair started to fall out, I switched back to my old combination straight away. I was very glad I did, because a blood test showed that my cholesterol rose to the highest it had ever been when I was on TAF. As a black woman whose parents both have diabetes and hypertension, and also as someone who has had breast cancer, the implications for weight gain go beyond not feeling happy about how I look, which is important in itself. It's also the long-term implications to my health and indeed my life expectancy. So what needs to happen now? Despite being disproportionately affected by HIV, women continue to be significantly underrepresented in most clinical trials. This must be addressed urgently so we can have the correct information about how medications may affect our health. We need to ensure that when women speak up about their concerns about weight gain, that we are believed, our concerns are taken seriously, and the correct action is taken. Too often, Black women in particular face discrimination in healthcare settings, not being believed when we speak up about our reality. This testimonial injustice can corrode confidence and prevent someone from speaking up in future. One thing women have said they don't want to happen is to have the option to go on certain medications denied to us. This was emphasised by the advocate Lucy Wanjuku-Njenka on an episode of AIDS Map Live I produced last year when we discussed weight gain. Choice is incredibly important to women, and although weight gain is a problem for some women, it is by no means an issue for all of us. What is important is that we are given accurate, reliable and accessible information needed to make informed decisions about what is right for our own health. Ultimately, knowledge truly is power. Thank you very much.